In this lecture of knee pathology, we will discuss the pathology that is the chondromalacia. Chondromalacia, also known as runner's knee. This is very important for MCQ's point of view. It's also known as runner's knee. It is a condition when the cartilage on the undersurface of the patella or knee joint destroy and soften. It is also known as runner's knee. In this condition, the cartilage under surface of the patella or kneecap deteriorate and soften. This is the definition. There are many causes of chondromalacia. Poor alignment due to congenital condition. It may due to the congenital condition. Weak hamstring and squats, weak knee flexors and extensors, muscle imbalance between abductor and adductor, repetitive stress to the knee joint such as from running, skiing or jumping, a direct blow or trauma to the kneecap. These are the causes. It may be congenital, weak muscles imbalance, repetitive stress or the trauma to the kneecap. These are the causes. The test we will do for the chondromalacia is the Clark's test. In this test, the patient lying spine. Place the web space of your hand just superior to the patella while applying pressure downward and inferiorly, and ask the patient to contract the quads. When the knee is the extension, this is the contraction of quads. Patient can straighten his knee as possible. Then the quads become stretched, and if patient feel pain with the movement of patellofemoral joint, then it is the positive sign of patellofemoral joint dysfunction or chondromalacia, and the Clark's test is positive. This is the test. Always remember, it can ask in MCQs. Then which test is used for the chondromalacia? This is the Clark's test. The rehabilitation of chondromalacia is also very important. In the phase 1, this is acute phase. The goals in this phase is to control pain and inflammation. As all the diseases, we can first control pain and inflammation, pain-free flexibility exercises and the quadriceps activation, and pain-free knee range of motion. These are our acute phase goals. The intervention we do is the range of motion and flexibility. We will discuss before. Cycle with minimal resistance. If patient has no pain, we can go for cycling, heel slides, lower extremity stretching. Lower extremity muscles, you all know, quads, hams, all stretching is very important. Hip rotators, hamstring, you can see rectus femoris, IT band, lower extremity stretching, heel slides, and if patient feel no pain, then we go for cycling. Strengthening of the quads is also a intervention we use in the phase 1. In the phase 2, subacute phase, the goal in this phase is to continue protection of the injured joint, improve flexibility, and begin to strengthen the areas of the weakness. The muscles where there is weakness, we go for strengthening, protection of injured joint, and improve the flexibility. The intervention we do is the range of motion and flexibility. Cycling, if the patient condition improve slow progression of resistance. Cycling is for the strengthening. There is a resistance in case of cycling, and with the resistance this strengthening improve. Range of motion and flexibility also improve. Continue flexibility from the phase 1. In the phase 1 we also focus on the flexibility. In the phase 2, continue flexibility phase. Strengthening is also very important. Begin open chain strengthening. Open chain means the distal joint is free. Knee extension exercises is also best for the strengthening, in which it has hip extensor rotator, hamstring curls, hip abductor, straight leg raise if there is pain-free arc. Chondromalacia rehabilitation phase 3, it is subacute phase. In this phase we have many goals. Continue to avoid exacerbation of the symptoms. Avoid the worsening of the symptoms. If the symptoms pain increase, we discontinue the exercise protocol. Continue to maximize return of strength and flexibility. Continue to patient go to his ADL's activity of daily living, establish closed chain strength and stability. First we have open chain, then we have closed chain, in which distal extremity not open, not freely move. The intervention we do is the range of motion and flexibility as before. Continue cycling for the resistance strengthening. Continue lower extremity stretching from phase 1 and 2, you can see, but only the new thing is to increase the progression according to patient condition. Continue progression of open chain program with ankle weights for improving the blood circulation. Calf muscles can add gym equipments. Also we can also add gym equipments, that is the leg press, uh, hamstring curls, multi hip, quads to the 90-degree, stress pain free range, and the proper frontal and the sagittal plane mechanics. Frontal planes means from the right to left, and sagittal plane means forward and backward. Step up progressions, we can go for progressions: pain free close chain hip strengthening exercises, cardio exercises to improve the blood circulation, for and also for the strengthening. Cycle with progressive resistance elliptical if pain free, and we also do swimming exercises for the patient recovery. In the last phase, that is the phase 4, return to the sports activities. In this phase we have a goals: continue to avoid patellofemoral overload, don't overload the joint, that is in the healing phase. Progress with single leg strengthening, achieve strength and flexibility to return to the activities. If he is an athlete, he can return to the sports, then continue to increase his strength and flexibility training. The intervention in this is the flexibility, daily stretching, cardio exercises, continue cycling, elliptical, and swimming as we discussed this before. Return to the running program as is always supervised by a physician or his physiotherapist. The strength training in this is continue SLR program and gym equipment progressions, continue step up progressions. All the exercises are same but with increased progression. Static lunge, lateral lunge, progressive single leg strengthening also included. And this is the question, then you can give answer in the comment. What is the test we use for the chondromalacia? Thank you.